All right, well, I've got two after, so we will go ahead and get started for today officially. Uh, Good evening from Michigan, everyone. My name is Bridie. I use he, him pronouns. I'm the executive director for the NASW Michigan chapter. If you've been on one of our student series before, you've probably seen my face. It's really good to be with you all this Social Work Month. Happy Social Work Month. We hope you are celebrating, and we are celebrating together collectively on this March 20th. We are very excited for this incredible panel you all are about to be exposed to. This is a rock star group of social workers that we've got for y'all today. Some really pioneering folks within the social work profession, some social workers who are doing some really inventive and creative areas of social work practice. And as we were thinking about our program for Social Work Month, and as we get towards the end of the semester, really wanted to give our social work students across the country an opportunity to explore areas of social work that maybe aren't talked about as much in social work curriculum or in programs, that we may hear on social media pages, but don't really know folks who are practicing in those arenas. And today we wanted to put some amazing social workers in front of you. So we're going to be talking through international social work, sport social work, human-animal connection, Indigenous social work community, as well as AI and technology in social work. We've got 5 panelists, and then we also have 2 kind of moderators who are going to be helping out, as well as some student volunteers once we get into the breakout sessions. Like I mentioned, we are going to be recording today's session, so if you need to step out or away at some point, we will have the recording available on the NASW national website, probably within about a week's time. So please feel free if you want to come back and watch any of the first part of the session today. That will be available for folks. And if we have any handouts, we'll make sure that those are available for everybody as well. With that, I'm going to go ahead and turn it over to one of our student leaders for today. Janelle, take it away.
Hello, everyone. I am Janelle DeClerc. I use she, her pronouns. I am a intern with the NASW Michigan, and I am one of the lucky people that got to plan and put on this event for all of you. So tonight's event is called Exploring the Unknown, Unique Careers in Social Work. And as Dwayne said, we have a rock star panel with a lot of unique social work careers that we don't get to hear about. So just a breakdown of tonight's lineup, we have our presentations that are going to occur. They're going to be about 10 minutes each. We're going to get to hear from each of our panelists about their career and what they are doing, what wonderful things they are doing in social work. When they are done with their presentations, so in about 50 minutes, as they're each going to have 10 minutes each, we are going to have 2 breakout room sessions. So you will get to choose which breakout room you will get to go into, and you will get to choose the presenter. And so any questions that you have thought of while listening to their presentations, you will be able to ask them these questions in the breakout room through the chat. So we'll do that for 15 minutes. So you don't only get to see one of these presenters more, you get to see 2 of them. So you'll get 15 minutes with one, and then we'll all come back to the main room, and then we will send send you out to a second breakout room with a second presenter, and you'll get to hear more from them. So that way it's more of an exploratory event tonight. These are our wonderful presenters here tonight. Any questions that you can think of while they're presenting, please jot them down on a piece of paper, so that way when we go out into our breakout rooms, you are able to remember those questions and ask them in the chat in the breakout room. With that, I would like to introduce our first presenter tonight, which is Abigail Eller for sports social work. All right, go ahead, Abigail.
Wonderful. As Dwayne said, good morning, good evening, and good afternoon, because folks are all over the place. So my name is Abigail Eller. I am a clinical associate professor at the University of Michigan School of Social Work. I also do a couple other things. So I'm the director of our sports social work program, and I have my own private practice and consultation services. And then I am the owner and chief education and product officer from Momentum Labs. And I'll talk a little bit about that. So let's venture into what sports social work is. Like, what is this really about, and how is this an emerging field of practice for us as social workers in the field? I always like to start with this quote from Nelson Mandela because I feel like it really has the power of what we do and what sport is, because sport is universal. It brings people together with varying abilities to engage and develop and create change for all. And so what Nelson Mandela said was, sport has the power to change the world. It has the power to unite people in a way that little else does. Sport can awaken hope where there was previously only despair. Sport speaks to people in a language they can understand. And so when I think about what is sports social work, like how did I get into this profession? I started in child welfare. I was doing forensic interviewing for children that had experienced sexual abuse, working with their families, both on the assessment side and then also on the treatment side. I noticed that there was such a huge impact of the correlation between child sexual abuse, mental health related risks and issues, and then working in the Native community, saw such an increase in suicidal ideation with plan and intent. So I decided to specialize in both sexual misconduct, sexual assault, and suicidality. And it took a while for me to get back into the sport space, about 10 years. So I played at Michigan. I played on the junior national team for the United States, and I played water polo. And it took me some time to figure out, like, everyone in sport comes from all these different spaces and places. And what I realized about social work in sport is that it was this integration of social work principles and practices into athletic settings. So helping support mental health, emotional and social well-being, and really wanted to focus on the key areas of mental health, injury recovery, social justice issues, advocacy, and then career transitions. So as sports social workers, what I noticed is there was a huge integration between social work, values and ethics, and our socio-ecological framework, a person in the environment, and athletic performance. And saw that as myself in my own athletic career. And then I kept seeing the same trends, the same things happening. And so really stepped in to help those at different stages in their career, from those that are really young to those that are transitioning out of sport and retiring. On this slide, this what is a sports social worker, I thought I would highlight a couple of my colleagues. The first one's Tarkington Newman. Dr. Newman is at the University of Kentucky, and he focuses on how sport can be utilized to promote healthy development and using recreation to do so. Rachel Amity is the director at University of Wyoming, the athletic counseling department, so she's working in collegiate sport. Emily Klee, phenomenal. She was at Michigan and is currently the program manager for USA Swimming, looking at mental health, wellness, and well-being. The late Greg Harden, who has been a mentor to many in this field. He was a pioneer. He started this work in the 1980s and has been referred to as the University of Michigan's secret weapon in the athletic department. There's a huge 60 Minutes episode on him. And he did everything across the spectrum. So he was doing interpersonal practice, and he also was an executive associate athletic director leading many, many sports at the University of Michigan. Cooper Tanko is a high performance coach at Momentum, working on her CMPC, which I'll talk about. And she's also a program manager for undergraduate studies at the University of Michigan. And then Warren Clark, who focuses on athletes in sports, working with older adults and field education. And so he has made his career out of how to use sports to advance change. Now, I could go on and on with all these different people, but I also thought it would be great to show you a little clip about what we do and what this means to us in the profession.
The real mission, my objective, my obsession is to help people become the world's greatest experts on one subject, on themselves. One of the things that I emphasize and teach, if your life is going to work, it's going to be because of your decision making, your ability to have healthy relationships, and to be able to take total control over what you can control. First order of business is trying to be in control of your thinking, your decision making, problem solving, and how you interact with others. So 17 to 23, that age group is a terribly exciting group to work with, because this is when you get a chance to let the adolescent child begin to take a back seat to the young adult. If you want to be the best, you have to develop yourself in more than one area. Can you imagine having a young person in my office and trying to explain to them they could be a better athlete if they're a better person? Trying to explain to them if you fight to be the best academically, you increase your chances of being the best athletically. That's a tough sell sometimes, but you have to push people to understand that everyone comes with baggage. There's stories in our industry, in our lives. There are stories with our peers. There are stories with young athletes who are the absolute best, all-American this and all-American that, who turn out to be human beings struggling with the same things that everyone else is struggling with. Understand that the NCAA, the Big Ten Conference, conferences all over the United States have put an emphasis on mental health. And what we've discovered is how crucial it is to have a variety of folks that people can talk to, who look different, have different backgrounds, and we've done an exceptional job of making a commitment to making sure that our students had access to a wide range of specialists, people who specialize in anxiety disorders, people who specialize in eating disorders, depression, people who are comfortable with the range of issues that these students bring. I'm so excited about what it means to have the type of team that we have. And as our athletic director indicates, if the center of the target is the student athlete, then we're moving in the right direction.
Okay, so like I said, the late Greg Harden, he passed away in September of 2024, and really was instrumental in this field growing. And when I look at like why sports social work is important, I think it's highlighted in that video, but I also think it's important for us to recognize that athletes face an immense amount of pressure from fans, from coaches, and more so themselves. Identities are deeply tied to their performance. Good person, good performance, good person. Bad performance, bad person. It's this way in which an athlete's brain sometimes is wired. And so helping, as a sports social worker, teach athletes to make these transitions at various stages in their development, from when they start to when they retire, has become a huge area where we have been able to step in and provide that support. I think it's also it's important for us to recognize that athletes face a lot of different things: financial instability, discrimination. We see a lot of sexism in sports. We've seen that at the forefront of social media. And so bringing awareness to that and addressing the injustices that exist on a large scale, on a large stage, has been a place where social workers have been able to provide the support to improve people's lived experiences, not just within sport, but outside of sport, using sport as a vehicle for change for everyone. There's a lot of different key roles that sports social workers play. First and foremost, I always say, like, mental health supports are key. There are a lot of us across the NCAA, professional sports, helping athletes deal with mental health concerns, depression, anxiety, crisis, whether it's personal or professional. And so when we're assisting athletes in these transitional stages of their life, or these different points in their life, it's an opportunity to help provide guidance, awareness, things that we would do both clinically and then also in macro practice when we're doing more advocacy and social justice work. So we're able to address various aspects as sports social workers to build resilience and maintain healthy relationships and ultimately lives. So where do sports social workers work? We literally work everywhere in various environments. I have worked in professional sport. I worked for the Detroit Lions. I've worked in the MLB. I'm the former director of mental health and high performance at the University of Michigan. And then currently am working with folks across the spectrum of life, right? So across lifespan, I'm working, I think my youngest right now is 8 that I'm working with on performance. And then folks that are in the latter stages of their athletic careers, who she's actually 72 and she is just rocking and doing amazing things. So you see how sport can take up a large part of people's lives. We see sports social workers in high schools and in youth sport programs. Many organizations, nonprofit organizations doing great work as allies, as co-conspirators, as accomplices. The Players Tribune Athlete Ally is a remarkable nonprofit agency that's really leading the way for our 2S LGBTQA plus community. Rehab and recovery centers, and then again, just different nonprofits, and on multiple levels, the meso, the macro, and then also the micro, really helping athletes along their journey of life. People always ask me, like, what does it look like for you? Like, what does a day look like for you? And no day is the same. I think a lot of us can agree with that, whether you're in a field placement, whether you are, early career, late career. But I ended up just putting up this slide because the first thing that I thought of was like one day that came to mind. We had a collegiate soccer player that was experiencing anxiety due to performance pressure and stress. That same day, we had an athlete die by suicide, and it impacted our entire community. And then also had a presentation on social justice and sport-related activities and issues, and then creating, what does that mean? Like literally creating policies and practices and you name it, like have done it all in one day. And it requires us to have different skill sets, strong networks and relationships, so that we can produce these outcomes. We want to advance, support, and educate the entire community on signs and symptoms and resources available. We want to gain a deeper understanding and awareness and community engagement opportunities that are widespread. We definitely want to continue to help decreasing stigma, myths, and misconceptions about athletes and their mental health. And then we want to improve well-being and sustain high performance. There's some challenges in the work that we do. So despite the importance of social work in sport, we definitely run into different barriers. One of the big things has to do with just limited awareness and acceptance. I think that's true sometimes for the social work profession, but we definitely see that in the sports space because a lot of people kind of default to either sports psychology or more administration business specific roles. So many teams and sport organizations are unaware of our roles and sometimes underestimate the value of our roles until they're exposed and really understand. Funding continues to be a hurdle issue. The amazing thing is all pro teams that like the highest level, so the NCAA, the NFL, NBA, Women's National Soccer League, they all require a mental health provider available to their athletes. So it's important for us. What they're noticing is the stigma is there, the need is there. And so cultural stigma, us getting in and having these conversations in sport settings has increased advocacy and decreased negative impact on people's lived experiences. And we're almost wrapping up. So people always ask me, like, how do you become a sports social worker? The recommendations typically have been getting your MSW and then taking classes that focus on sport, kinesiology, psychology, but most importantly, people. Right? It's important to understand people and to have a niche that you can bring into the sports social work space. Other thing is looking at certifications. So whether that's licensure or specialized trainings in sport, and then experience. If you can find your field placement in a sport setting, whether it's a nonprofit or higher education or with a youth group, there's just a lot out there. And there's a manual that was created by ASWIS that is available for folks that want to create sports social work placements. So there's guidance for higher education to do so. To gain more information, we do have a sports social work program here at the University of Michigan. It's offered every summer. There's other sports social work programs that exist across the country that are certificate programs. These are continuing education programs. So that's a way to kind of, learn a little bit more, because there's not a lot of folks out here that are doing the work. We are rising, but it's still a lower area. That's why we call it emerging, right? And then we can explore different associations. And then if you're looking at doctoral programs, the University of Kentucky now has a sports social work research lab. So as this field continues to grow, make sure that you figure out, like, is this for me, right? Like, is this something that I'm really interested in? Because at the end of the day, sports are meant to be fun, right? That's what Nelson Mandela was talking about, the power of change. And the future of sports social work is really promising. When I first started in this field almost 20 years ago, there were very few of us. And now we are in athletic departments across the country, running them. The athletic director at the University of Michigan happens to be a social worker, Ward Manuel. And so when you've got folks that are running these huge Power 4 institutions with social work values and ethics, it's something to really be proud of for our profession. So when I think about the awareness of mental health and social justice and athletics, we've got an opportunity to promote change and be part of change. And so really encourage folks to explore this as an opportunity. So I'm just going to wrap up. Thank you all, and look forward to hearing from Dr. Reamer next.
Thank you, Abigail. So like she said, if you want to look or hear more from her, please join us in her breakout room after the presentations. And this session is being recorded for those of you that were not in here at the beginning. So if you are looking at this and hearing, oh my gosh, that's something I want to remember, that's something I want to see again, there will be a recording of this. Next up is Dr. Frederic Reamer on AI and technology in social work.
Thank you very much, and welcome to all of you. My path into social work and throughout my career is quite different, radically different from Abigail's in most respects. I became a social worker in the 1970s because of my passionate interest in criminal justice. I had worked in prisons and wanted to get the social work degree to advance my career. This is one of the first prisons I worked in. This is a federal prison in Illinois. And when I worked in this prison, I was working with an inmate and discovered that the inmate with whom I was working was in a protracted dispute with another inmate, which is not that unusual if any of you have worked in prisons. And this client of mine, this inmate, shared information with me that led me to believe that he was likely to assault this other inmate with a homemade weapon. And that threw me into the midst of my first ethical dilemma, because my client, this inmate, had shared with me confidentially, air quotes, information that led me to think that I might need to disclose that information to protect a third party. And at the time, I was a PhD student at the University of Chicago, working in the prison at the same time, and realized that our profession had not produced much in-depth conceptual analysis or framework to help social workers identify ethical dilemmas, to help them navigate difficult ethical dilemmas. And it just so happens that at that time, there was a new field emerging, variously called professional ethics, bioethics, applied ethics, practical ethics, all those names are used. And I decided to start studying this emerging field and apply these conceptual frameworks to social work, because frankly, at the time, no one was doing that. And I thought, well, you know, folks are doing this, especially in medicine, bioethics, we should be doing this in social work. So I started to do some writing on the subject, and I was invited to participate in a project in 1980. Some of you were not alive in 1980. Sponsored by the Hastings Center. If you look in the upper left-hand corner, you'll see the Hastings Center, which to this day is one of the preeminent ethics think tanks in the world. And the Hastings Center had gotten a grant from the Carnegie Corporation to bring together scholars from a variety of fields, medicine and nursing and law, business schools, etc. And they took the deep dive and discovered that I had written some stuff on social work ethics, and they invited me to be part of this group. And our charge from 1980 to 1982 was to identify for the first time compelling ethical issues in our respective professions and to design curricula to teach this in our case, social work education programs. I wrote this book that came out in 1982 entitled The Teaching of Social Work Ethics, which was published by the Hastings Center. And that book identifies what at that time, right, do the arithmetic, that's a long time ago, that's 43 years ago, what then were compelling ethical issues in social work. And I argued we ought to be addressing these in social work education programs. As a result of my work in this arena, I continued to work in prisons, various prisons. I've worked in prisons for 27 years of my career, but I've also devoted much of my career to the identification of ethical challenges in social work, development of conceptual frameworks for thinking these things through. And I was privileged to have been asked to chair the national task force that wrote the Code of Ethics for the social work profession. I devoted 2 years of my professional life to chairing the task force that wrote the code, which is, for all intents and purposes, the code that we have in force right now. This was in the mid-1990s, at a time when technology, as we know it today, did not exist. So the code that my colleagues and I drafted in the 1990s did not say one word about ethical issues that arise when we provide services to clients remotely, because there was no such thing. At that time, a tweet was the sound a bird made, full stop, not something associated with a smartphone app that used to be called Twitter, now called X. At that time, the cloud was the white fluffy thing in the sky, not where you store electronic health and medical records, because they didn't exist in the 1990s. In the mid-1990s, TikTok was the sound a clock made, full stop, not a smartphone app, where some social workers have gotten into ethics hot water because they've recorded portions of a session and posted them on TikTok. So during the last 30-some years, since I had the opportunity and great privilege to have chaired the task force that wrote the Social Work Code of Ethics and to help update it, I've had to learn a great deal about the ways in which ethical challenges arise in social work, the need for our ethical standards to evolve. My first book on this subject was published in 1982, not the one I showed you from the Hastings Center, but this is a more academic book, Ethical Dilemmas in Social Service, 1982. And that book does not say one word about ethical challenges associated with social workers' use of technology to provide services remotely, to communicate with clients outside of normal working hours, to conduct online searches for information about clients without their knowledge or consent, and on and on and on. So in more recent years, I've had to work very hard to work with colleagues to add technology-related standards to our Code of Ethics. In recent years, we've added several dozen standards in our Code of Ethics to address technology-related challenges. I now spend a great deal of my time consulting on legal cases as an expert witness in litigation and licensing board cases that I discuss in this book entitled Risk Management in the Behavioral Health Professions. I've worked really, really hard to develop ethics-informed practice standards governing. So, by the way, this is the first Code of Ethics in social work. It was 1 page long. This was the first Code of Ethics in social work, 1960, 1 page long. The current code is, 30-some pages. Recently, I chaired the task force co-sponsored by these 4 prominent social work organizations: NASW, the Association of Social Work Boards, the umbrella group for all licensing and regulatory bodies in North America, including Canada, the Council on Social Work Education, and the Clinical Social Work Association, to develop ethics-informed practice standards governing social workers' use of technology. This group spent about 18 months. There's the task force right there. And when we developed these ethics-informed standards, I did not use the phrase artificial intelligence because it was not yet part of our vocabulary. But now it is. And last week, the NASW Press released my newest book entitled Artificial Intelligence in the Behavioral Health Profession: Ethical and Risk Management Issues. If someone had told me at the early chapter, the first chapter of my social work career, that I would have the privilege to chair the task force that wrote the NASW Code of Ethics, that several decades down the line, I'd be writing a book on social workers' use of artificial intelligence to provide services to people who struggle in life, to provide clinical supervision, to record their clinical notes, I would have thought, you have got to be kidding. You have got to be kidding. But here we are. Here we are in 2025, and I now spend a considerable portion of my time consulting on ethics and risk management issues associated with social workers' use of technology. The reality is, I didn't see any of this coming. And I think there is a profound lesson here that those of you who are at the front end of your social work careers, pay attention. Pay attention, because you never know what's going to emerge as challenges in our profession in ways none of us could have forecast. Pay attention, because there may be opportunities for you down the road to work on issues related to social work that have not yet seen the light of day. Social work ethics. It's a moving target. It's been a privilege for me to have been part of this profession for decades, to watch it evolve, to really grapple with the ways in which our own values and ethical standards have evolved. And I hope this is an important part of your journey as well. Thanks for inviting me to be with you.
Thank you so much, Dr. Reamer. It is a pleasure to have you on our panel tonight, and we are so glad that we got to hear from you tonight. Up next, we have Brianna Dobbs on the human-animal connection. So Brianna, go ahead and take it away.
Hi, everyone. My name is Brianna Dobbs, and I am someone who is newer into the field. I do have my MSW, but I am just honored to be able to talk to you about the human-animal bond in social work and how I got here. So I do... Sorry. You can go to the introduction one. Yeah, okay. So sorry about that. So I am currently working for Michigan Humane as a community advocate and focusing on the human-animal bond. Just so you are aware, Michigan Humane is the oldest and largest animal welfare organization in Michigan. Just to put some context into some of the work that we are doing. We have 3 veterinary clinics, 2 animal shelters, also field services, cruelty investigation, and various community programs, which I mostly work in the community programs. And the mission of Humane Society is to improve and save lives through compassionate care, community engagement, and advocacy for animals. Go to the next slide, please. So how did I get here? Sorry, public speaking is not my forte, and talking after Dr. Reamer has me so nervous. Can you actually go to the previous slide? and I will get it together. Okay. So how I got into this field. So I've been a helper as long as I can remember. Throughout my childhood, I actually wanted to be a veterinarian. Life happened, and I kind of got into a dark state, and I started out as pre-veterinary medicine in my undergrad, and I actually changed to psychology, focusing on addiction studies, and worked in substance use treatment for about 10 years. And through that time in my life, my pet, Fritz, who you can see here, was a lifesaver to me. He really was. I'm sure a lot of you have pets here and know how much they mean to you and how pets are truly family members for folks. And he was my rock, and he truly saved my life. And my career in substance use treatment, I kept coming across the barrier of pets for folks and people not having a place for pets to go to seek treatment. So that actually inspired me to go back to school for my MSW, and with the intention of one day opening a treatment center, a recovery housing, not exactly sure yet, but that would accept pets. And then I came across, after graduating, Michigan Humane, who was starting to do this work on the human-animal bond, and became aware of veterinary social work, which, if you're not familiar with veterinary social work, there is a lot of different paths you can follow. And I implore you to check out the International Association of Veterinary Social Work. They are doing lots of great work about that. You can go to the next slide, please. So an overview of what does a typical day look like. So far, I have not found a typical day. Still trying to figure that out. We're still doing a lot of program development. The primary focus is pet retention and wellness for people and their pets. So one of the main programs we have is our Safety Net Foster program that provides temporary care to owned pets for instances such as hospitalizations, treatment. My job is to work with that person to create a plan for reunification, providing human service referrals, and also building relationships with human service partners to kind of bridge the gap between animal welfare and human service organizations. We also have pet food pantries that partner with human food pantries and other human service organizations to provide pet food for folks to get their needs met and their pets' needs as well. We do a lot of community outreach events, large vaccination clinics and wellness clinics for folks, where we provide veterinary care to the animals, preventative care, but we also have a human service fair going on with human service partners that have resources for folks in the community. And I realize we are all over the United States. I am primarily in Detroit, Michigan. So if that gives you a little context with the location of the work that I'm doing. There is, with the Safety Net program, we get a fair amount of folks who may be fleeing domestic violence. There is a huge link between human and animal violence. And we're also, there are states that have mandatory cross-reporting for, sorry, I'm getting distracted by the chat. Mandatory cross-reporting for vulnerable adults if animal violence is a concern, that there may be, there could be violence towards children or vulnerable adults as well. So there is, Ohio is one state that does have mandatory cross-reporting, and that's something we're raising in Michigan as well, starting conversations. Go to the next slide. We're also working with a lot of homeless shelters throughout Detroit for co-sheltering, domestic violence shelters for co-sheltering. There are a few that are accepting of pets and more that are coming aboard. And a lot of folks know that pets are family. There's just a lot of concerns about liability and things like that with animals. So doing work to bridge those gaps. Some of the challenges, this is a pretty new field. So there is resource scarcity, and with the location being in Detroit and Metro Detroit, resources can be very thin, especially with housing. There is a huge lack of affordable housing in general. I know most of you are probably aware of the housing crisis, but then the lack of pet inclusive housing as well makes things even more challenging. There is a lot of misinformation on the human side and the animal side of things. And also just with being in this role, and it being so new, the language between animal work and social work, kind of bridging those gaps and things, it can get confusing at times. And then a lot of the challenges surrounding compassion fatigue and burnout is veterinary medicine has one of the highest rates of suicide for occupation. So some of the work we are doing as well is bringing social work aspects to help with compassion, burnout, and fatigue. And that's something that I'm honestly learning a lot from with folks that have been in the field for a while, leaning on them and learning how they have been kind of handling it. And then the impact, biggest impact, expanding access to care for people and pets. Healthy pets make healthy families, make healthy communities. And when I say access to care, I mean access to care for humans and for pets. Because sometimes I work with somebody who they might be reluctant to reach out to human service organizations because they've been told no so many times, but I can kind of connect with them through their pet and get them the services that they need. So I'm truly working in my dream job. It is pretty amazing. It's also great to be able to empower providers to support people and pets and have those conversations, and ultimately keeping families together, happy and healthy. And
Thank you, Brianna.
Thank you.
Thank you, Brianna. It was lovely hearing from you. Up next, we have Linda Levin with International Social Work. Go ahead, Linda.
Hi. Well, good morning, good afternoon, good evening. Welcome. Thank you all for coming and joining us this evening. Very similar to Brianna, I still feel like I am very new in my social work career. And so to be asked to be part of this and also to be on this amazing panel, I am always kind of grateful for that. And so I will start with international social work and immigration. This is a nice little kind of photo of the UN and UN New York. I am from New York City, so here's just kind of the little pretty picture. So a little bit about me. My name is Linda Levin. My pronouns are she, her, hers. I always lead with accessibility. So I am a white Hispanic woman. I have long black hair. I have glasses on, and there should be a white wall behind me that is a little kind of blurred out right now. Just for awareness, I had a beautiful presentation that was all nice and fancy, and about an hour ago completely got deleted, but we're going to have a little bit of grace, and I made you something anyway, and I'm here, and we're going to have a good time, so it doesn't matter. I work with students all the time, so I'm very grateful for all that. I got my Bachelor's of Science in Social Work with a minor in Disability Justice at the College of Staten Island. If you don't know the College of Staten Island, it is part of the City University of New York, where I currently work. But what's interesting about that, I'll drop a little bit of knowledge, is that if you've heard of the Willowbrook State School, that's where they became the policy of the civil rights of institutional persons, CRIPA, which then eventually led to the ADA. So all kind of interesting things from a school in which which I got my degree from. Went on to get my Master's of Social Work from Fordham. And that is kind of how I got into international social work. So Social work wasn't the first choice for me. I was majoring in chemistry. I was going to go to pharmaceutical school. That was the thing. And then, like I just said, life happens and lifes, and I had to drop out, and because both of my parents got sick, and then I became a caretaker to both of my parents. And then they are a middle-class family. They had really great insurance, and then suddenly we were finding out was that they were getting denied for services that should have been covered. And I couldn't be part of a system when I wanted to finish my degree that would kind of perpetuate the problems that were happening. How can you deny people medication and services that they medically need and doctors are saying they need? So I kind of pivoted to social work. But I knew that I wanted to get into policy. I knew I wanted to get into advocacy. I was already advocating for the rights and health and support of my parents. And so I was going to take that passion into all different areas. As you can see by my kind of work history, I did nonprofit work, disaster preparedness, policy, advocacy, and right now I'm currently doing social impact and workforce development at the City University of New York. As social workers, we wear many hats and we do a lot of different things. And so that is currently where I am. If disaster preparedness is obviously a big thing because we all kind of lived through COVID, right? And so that is a global problem. What happened around the world makes us global citizens, and that it affected everyone, no matter where you are from in the global South, as well as in the biggest city in the world. I'm biased, New York City, right? So that's just kind of a little bit about my work history and what that happens. When I got into my master's program, I met the most amazing person, my mentor, Dr. Elaine Congress, and part of that got me into the UN and allowing me to do policy and advocacy. So like all of you currently in your field placements right now, my field placement was at the UN, and then I was able to get a contract and do that. So you never know who you meet. If you have a professor you're close to, please keep in contact with them. If you know someone at your field placement that is doing this work, that is a mentor for all of you, please keep them close. So right now I am the senior program manager at the City University of New York within CUNY Central. That is one university, 25 colleges in New York City. So it's really fun to be there. I am the co-chair of the NASW Immigration and Global Social Work Committee. We do a lot of policy and advocacy there that I'll go through a little bit. And I was at the United Nations, and I was a representative for International Federation of Social Work for the UN. And I'll go into a little bit, because when I talk about international social work, I think it's a little bit different to understand what you're doing, because you're kind of pushing social work even further than what we know as social workers. On the right-hand side, there's a photo of me standing at the podium at UN New York in the General Assembly. That was a great day. I got to meet His Excellency, the President of the General Assembly. So, and I got to also speak and talk, and so that was like a really great time. So I'm sure we're all here. We all know the definition of social work and our mission and what we're doing, but I'll read it really close just to have it. The primary mission of social work profession is to enhance human well-being and help meet the basic and complex needs of all people, with a particular focus on those who are vulnerable, oppressed, and living in poverty. Well, when we're doing international social work, there is a global definition of social work, and that is what we're practicing as doing human rights-based social work. So there are two major, as we know, we're all part of NASW. There are two other kind of coalitions, groups that work for in social work in an international scale. So just like we are members of NASW, NASW is a member of IFSW, which is the International Federation of Social Workers, and then IASSW, the International Association of Schools of Social Work. So those are just two more associations. Social work loves our associations, right? We love coalition building. But this is the global definition of social work. And social work is a practice-based profession and an academic discipline that promotes social change and development, social cohesion, and the empowerment and liberation of people. Principles of social justice, human rights, collective responsibility, and respect for diversities are central to social work. Underpinned by the theories of social work, social sciences, humanities, and indigenous knowledge, social work engages people and structures to address life challenges and enhance well-being. And the above definition may be amplified at national and regional levels. So I love this definition as an international social worker. I think that we're pushing social work even further, right? Because you don't get to have change that you want unless you're empowering and liberating people, you're creating sustainability, and you're changing structures that prohibit that opportunity. So that's just a little bit of kind of, as an international social worker, what you're working with and working towards. A big thing for me, as since all of you are probably in school, is that social work is grassroots to global. A lot of my work is within my community, is in my city, it is in my state, it is at NASW right now, nationally, all the way up to global, as I'm engaging with the Global South, the Global North, as well as the UN. So social work doesn't stop. If you're with people, you're in communities, you're in policy, you're in global. So I want you to take that into consideration. I always feel that if there's a job and it's open, a social work can and should be doing it, right? I think that we're given an amazing framework and that that's important. So what is the UN, right? How do you even get to become a social worker at the UN, and what are you even doing? So for many people who don't know, this UN system has 6 principal organs. It's a very huge system. There's a General Assembly, which we heard, the Security Council, the Social and Economic Council, the Secretariat, the International Court of Justice, and the Trusteeship Council. Mainly, everyone there, kind of when you're doing advocacy work, you're working within the ECOSOC, or the Economic and Social Council, what they call it ECOSOC, and you're doing advocacy, you're doing policy work, and then within that, you're working within the functional commissions and other body locations. So that is kind of where you do your advocacy work within the UN. IFSW, as I mentioned, is a member and has consultative status, which kind of like means that we're cool. So the UN wants us to kind of consult at the UN, and when it comes to policies and issues and problems, we also have DGC, which is communication, another kind of certification that they have. And the IFSW also works with the Human Rights Council, the World Health Organization, and the the United Nations Children's Fund, so UNICEF, as we know it. So these are just all different entities, and with social workers and IFSW in particular kind of worked. I had someone at IFSW who was part of the World Health Organization who said it took 10 years for them to advocate for mental health to be even considered part of health. So just to tell you how long it takes to get advocacy and get something changed, 10 years of advocacy to even get them to consider mental health as part of social or part of health. So this is the ECOSOC system. And as I mentioned, when you do kind of advocacy work, you're within the functional commissions. So particularly in New York, UN New York, they are divided amongst all the UN across the world, right? So there's multiple different UNs across the world. The 2 in New York, where I am, the 2 main commissions in which we focus on is the Commission on the Status of Women and the Commission on Social Development. Those are the 2 main commissions in which most of the work is done. But obviously a lot of the work has been moved to kind of Zoom stuff so that it allows the Global South to participate. So that's a really kind of great opportunity. I have a list of all the different commissions that they have, including like narcotics and drugs, population and development, Commission on Crime and Prevention and Criminal Justice, Science and Technology for Development, and the United Nations Forum and Forests. So these are just kind of some of the other commissions, but again, at UN New York, we focus on the Commission on the Status of Women and the Commission on Social Development. UN is really big, guys. So what are we working towards, right? Well, we have the Universal Declaration of Human Rights, and there are 30 human rights that we're working towards doing. Obviously, you're taking our social work background, and this is what we're going to do. There's 30 different human rights. I'm not going to go through them all, but obviously, if you know the UN Declaration of Human Rights, I had this really pretty, I wish you guys would have seen my other PowerPoint, but it's okay. We're going to have grace. And then we're also trying to achieve the Sustainable Development Goals, the SDGs. So there are 17 SDGs with 169 targets between the 17 SDGs. It's a lot of goals, but before that was the Millennium Goals, so they're kind of always changing. Who knows when we get to 2030 what they'll be called next. But it's everything from no poverty, zero hunger. So when you see the people speaking at the UN, this is what we're trying to achieve, right? We're trying to achieve these goals because we believe in human rights. We believe that there's 30 human rights that we all should have, regardless of your background, your location, and where you're from, to achieve these 30 human rights within the 17 SDGs. And so what are my main responsibilities? What am I doing, right? So whether I'm working within the NASW Immigration and Global Social Work Committee or at the UN or supporting students in this work, we're doing advocacy, we're doing policy, we're doing coalition building, we're doing education, we're doing research, and we're doing support. So the advocacy, you are learning, you are going to advocate, you are going to go somewhere, you're going to kind of work towards something, do the coalition building, policy. I've written policy statements that have been both accepted and published at the UN, and I've also written policy statements for NASW, in which we're working towards, last year, the mayor, if you know a little bit about New York City, and there was the influx of migrants coming to New York City, and Mayor Adams did not handle that very well. Mayor Adams actually came to me and the committee because they wanted a little bit of help, right? They wanted us to fix it. How do we fix it? And we did a lot of kind of policy and working with them to try to show them how you can better kind of control the money, do that work. We did an amazing policy statement on the history. We did coalition building. There's education. There's research. There's always something to research and figure things out, right? That's what we're doing. And we're going to support one another. A big thing that we've done, especially right now in the world that we're living in, is understanding the mutual aid and support that social workers can give each other, as we all have those same ethics and those same principles. And so it really is a space that we curate both at NASW New York, within the committee, as well as at the UN. We are doing all of this all of the time. It never stops, because why? The world never stops, right? Everything's always changing. And so there's amazing things. This is a little bit about the NASW New York Immigration and Global Social Work Committee. And I'll say, while I was at the UN, even though there's commissions, what I talked about, the status of women and for social development, there's also committees on a million different things. So I was on multiple committees, including the Immigration Committee. I was also on the Committee for Indigenous People, Committee on HIV and AIDS, the Committee on Women. So there was multiple committees. The UN loves committees and commissions. You'll hear those words a lot when you're in there, but it's okay. We focus mainly at NASW in the Immigration and Global Social Work on educating. We work within the community to help both immigrants, communities, policies, the organization, and they're affecting them. We do a lot of trainings. We do workshops. At NASW New York, we're having a full month of workshops in April. If anyone would like to come, I do my first one April 1st on just a very simple Immigration 101. And it is open. We advocate on behalf of immigrants, refugees, and asylum seekers. We again work with NASW, we do PACE and public testimonies. It is constantly, there's amazing policy statements that we've written, and we provide support to colleagues. So again, as social workers, everything is different, every issue is different, every single thing that we do is going to be different, but it's always the same kind of support of one another. It is open, the Immigration and Global Social Work Committee. So if you are interested in immigration, if you want to learn more about the history of immigrants and immigration in the United States, you can scan this QR code and join our committee. It is open. You don't need an NASW membership to join us. And you can kind of really have amazing opportunities. Really quickly, let's see, I think there's one more slide, maybe not. I think I'm done. Is that it? Okay.
Thank you so much, Linda.
Oh, wait, yeah. Okay, that was it. Save time.
All right, thank you so much, Linda. It was great hearing from you. And last but not least, we have Bridie Johnson on serving Indigenous communities. Go ahead, Bridie.
Ani, bonjour, everyone. It's so nice to be here. I'm really glad that you've taken interest in this important topic, especially in Social Work Month. And so, a little bit about me and why I joined the sector. I do a lot, first of all, with our unhoused relatives, and then MMIW and missing and murdered Indigenous individuals, as well as youth that are either Two-Spirit or LBGT identified and have either became unhoused due to aging out of foster care or not being accepted in their own homes and spaces. And so trying to create that space for them. And part of the reason, when I sit back and think about it is, when my grandma had polio before the ADA, before we had disability assistance. And so the fire department allowed my mother and her brother to live in their barracks for about 6 years with my grandma because she didn't have, otherwise that we would have been in all those systems. And so I always say I was unhoused in her womb. And so housing and helping individuals find housing has always been a huge importance to me. I sit on the National Healthcare for the Homeless Clinical Advisory Board to help around the country to just do clinical best practices with unhoused individuals. And I've done a lot of work when I was at the coalition with street medicine, like intertwining substance use disorder and MOUD treatment in the streets, which is harder to do than when you have people coming into the clinic, but still necessary and important for their lives as well. And so there's never, ever like really been a typical day for me. You know, the days can go from macro practice to micro practice all in one day. And so, you know, it's been extremely important to look at both of those ends of the coin in the context of the work that we're doing and making sure that, you know, we are advocating as much as we're doing clinical work. And that's kind of the uniqueness of the social work field. So the populations, I've worked with tribal entities. I've worked in an urban center called American Indian Health and Family Services, where we serviced all 574 federally recognized tribes, you know, 468 state tribes, and then any individuals that were pushed out of their entities, and worked on their behavioral health program, where I was able to integrate care into different tribal entities all over the country with Johns Hopkins University. And that was extremely powerful and impactful. So I think you can do anything. You can do anything in the world you want to do with social work, which, oh, what state am I in? I'm in, you know, physically sitting in Oregon. It's my partner and my 14th anniversary today. And so I'll give them a quick shout out because they're putting up with me doing this because social work is my love and it's kind of, you know, who I am. But after that, we will be, you know, well on our way. What was I? Oh, I was going to say something. I don't know. I've lost my train of thought in some senses, but I'm going to go ahead and cut us off just because of the time. And I want everyone to get the opportunity to get into these groups and to ask the questions